Testing.
It's pretty staticky, Brad. The feedback. It's scratching. Louder. Turn it up louder. It's scratching.
Testing.
It's really crappy, Brad. It's really scrambly.
Yeah, that's not going to be fun.
Testing. You got reverb. Testing. Down. Testing.
All right, that'll be good, Brad. It's a little bit slow. That'll be good.
All right, we'll get started. I'm Kevin Jessen, Communications Manager for the City of Muscatine. I'd like to introduce Mayor Diana Broderson.
Thank you.
Put your mask on!
Thank you, everyone, for coming today. Before I get started, I will just say, let's please be respectful so everyone can hear. And also let's understand that the proclamation does not require a mask outside if you are 6 feet from each individual, as you can see that I am. Thank you. I want to thank everyone for coming today and for all that you have done and are doing to carry on the work of our city. I know you love it as much as I do, whether or not our opinions vary or not. Unfortunately, in 2020, we have all been impacted by the COVID-19 pandemic and have been struggling to maintain some sense of safety and normalcy since it began in mid-March. What do I need to do?
Volume. Come on, Brad.
Should I move closer?
Only way we
Turn the volume.
not go to work.
We're turning it up louder. I would ask everyone to please be respectful so that everyone can hear. Muscatine County has 44 individuals and lost them to COVID-19. And over 600 of these have contracted the virus. It unfortunately isn't done hurting us yet, as we had 8 new cases within the last 24 hours. We closed our city for business and we stayed home. Stores, schools, organizations, restaurants, bars, and we as a city can and must look around us and learn from other areas. We as a city can and must look around us and learn from other areas so that we don't follow that same path. We need to do all that we can to prevent that from happening here. So what can we do to prevent us from following that same dangerous path? We look to our health authorities for answers and guidance to our questions of how do we slow or stop the spread of COVID-19 in Muscatine. The answer is the same one from all health professionals everywhere. We either don't go in public, or we wear face coverings, when we do, unless we can social distance, as well as following and sanitizing practices. Don't go in public? I don't think that's an option. We not only have an obligation to protect everyone in our city from contracting this deadly virus, but we also have an obligation to protect the economy of our city and keep it from having disastrous reclosing of businesses, some of which may never reopen. Individuals and families need to be able to go to work and provide for their families, and our economy needs to recover and regain strength. This week, a team of economists at Goldman Sachs made the case that a face mask mandate could partially substitute for renewed lockdowns as infections increase again. The economic health of Muscatine is completely based on us staying open for business. If our numbers continue to climb, indications are that we will follow suit with other areas if changes are not instituted. There will be no choice that things will close down again. But we have another option of not going in public. We can wear face coverings when we do go in public if we cannot maintain a 6-foot distance between us and other individuals. I would like for everybody to be able to hear. This seems, if you would like to hear what we have to say, I would ask for you to please remain till the end. Now is the time. Do you wish to hear this? Well, then go home. I am trying to explain the background for where we're at, why we're here, and what will be the process going forward. I will explain that when we get to the proclamation. Let's be proactive so we can keep our people safe and keep the doors of our businesses open and serving the public. Wearing face coverings has been proven effective in minimizing and preventing the community spread of COVID-19. I have asked, we will address that if you would please let us finish. I have asked Christy Roby Williams, the Director of Muscatine County Public Health, to please speak to this issue for you. Thank you.
The Public Health Department of Muscatine County supports all efforts that promote the widespread use of precautionary measures that we know to be effective in reducing the spread of infectious diseases and aligns with disease control efforts recommended by the Center for Disease Control and Prevention, also known as the CDC. Our position in public health is to prevent, promote, and protect the health and wellness of our county residents. According to the CDC, the best way to prevent illness with no pharmaceutical prevention is to avoid being exposed to this virus, as this virus is known to be spread mainly from person to person. The CDC states that in order to protect the health of the public and reduce the spread of COVID-19, everyone should wash your hands frequently for at least 20 seconds or more, and if hand washing is not available, to utilize a hand sanitizer that contains at least 60% alcohol. Avoid close contact with others. Effectively cover coughs and sneezes, clean and disinfect frequently touched surfaces daily, stay home when you're feeling ill, and cover your mouth and nose with a face cover when around others. Face coverings are recommended by the CDC as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people when the person wearing the face covering coughs, sneezes, talks, or raises their voice. This is called source control and supports risk reduction and population health during a pandemic. This recommendation is based on what we know about the role respiratory droplets play in the spread of the virus that causes COVID-19, paired with emerging evidence from clinical and laboratory studies that shows face coverings reduce the spray of droplets when worn over the nose and mouth. COVID-19 spreads mainly among people who are in close contact with one another within about 6 feet. So the use of face coverings is particularly important in settings where people are close to each other or where social distancing is difficult to maintain. As of today's data from the Iowa Department of Public Health, Muscatine County has had a total of 633 positive cases of COVID-19, and as you heard Mayor Broderson announce, 44 deaths for our public health department. That has been an unbearable loss to our county and to our county residents. We currently have 49 active cases in our county, of which 4 people are currently hospitalized. According to our local public health department data, over half of these active cases appear to be in the city of Muscatine. We know that in order to reduce the spread and manage this public health pandemic, we must consistently implement the precautionary measures we know to be effective in our field of study. I thank Mayor Broderson and all other community members, businesses, and leaders that have and continue to make the consistent efforts to help us managing these unprecedented times in public health. Thank you.